Hi everyone, this is Dr. Jayakrishna Reddy. I'm an Arthroplasty and Arthroscopy surgeon and I do complex trauma too. I work at Yashoda Hospitals, Secunderabad. I'm a senior consultant here. I'll answer a few queries which have been frequently asked about robotic knee replacement. The first query which I have seen frequently people asking me is how does robotic knee replacement differ from traditional surgery? You have seen, people have seen so many patients underwent traditional surgery and most of them are doing good, but 10 to 15% still they have pain. But here, after coming to the robo era, the patient suffering or patient having different other complications have come down because of one thing, like in robotic we have virtual screen where we can see the 3D model of the joint and we can assess what kind of sizes or what kind of implant is required there, so that which differs in a traditional way. We use manual zigs, we use surgeon's experience, and visually we calculate the things, whereas in the robo the digital 3D model is seen on the virtual screen and through that we calculate everything and execute the program. So the key difference is we get a accurate alignment and joint fixation is very precise. The second question is, do robots actually perform the surgery or is the surgeon in control? The robot never performs the surgery. It's a surgeon assisted procedure and we take the help of robot to get the proper calculation and we execute the things. It's a kind of guiding tool where surgeon has to also be experienced in that and trained in that, and it can be used for the patient. Third question is the robo knee safer than conventional knee replacement surgery? Yes, it improves the precision and it also reduces soft tissue injury. We don't release the ligaments, and we also alignment chances of our malalignment is reduced here, and early because of this, because of the precision and because of the lesser chances of malalignment, the important thing is longevity of implant is more and the failure chances are very less. And fourth question is, will the recovery be faster than the conventional knee replacement? Yes, the recovery is faster. In past, whatever the recovery I have seen in patients, which used to be almost 3 months, now the same 3 months recovery I have seen in 1 month of post robotic knee replacement. Patient is able to sit on a low chair and get up comfortably and walk independently within 1 month, and they're able to do physiotherapy also very comfortably with less pain post robotic knee replacements. So which implant is considered the best for long-term results is other question. There's no single best implant, and it all depends on the surgical technique, it all depends on patient anatomy and activity level and weight of the patient and implant design suitability. So implant material, oxidized zirconium, that's oxinium knee, is better. It has more lifespan and the allergies also are reduced. So that's a better implant which can be used nowadays. Are there any drawbacks in robotic knee replacement? Yes, a few. Slightly longer operative time, but it does not matter. End of the day, the result is important and longevity of the implant is important. And system dependent limitations, I mean cutting speed and hepatic boundaries are there, and it's not available everywhere, it's expensive. So, but still it's worth it, high cost, but still it's worth it. Is it more expensive than traditional surgery? Yes, the robotic surgery are typically more expensive due to few reasons, because high cost of the robo system and disposable instruments. We cannot use the same, reuse the instruments there, and additional planned scans are required for in few kind of robos. We need a CT scan be ahead a week ahead to assess to plan the surgery, and few robots it's not required. And insurance coverage varies by company to company. So these are the common questions usually asked. I think I have answered most of it. If any further queries, anytime you can contact me. Thank you.